So what we want to do right now, we're going to go out to this event live. Robert F. Kennedy Jr., you know him. He's the Secretary of Health and Human Services. He is meeting with two of Alaska's Republican senators, Dan Sullivan and Lisa Murkowski, talking about rural health care. Let's listen.
Especially Alaska Native health issues, where I would say he's not just passionate, but brings a level of expertise and commitment. So in our first meeting, I was blown away by his commitment to Alaska. We'll be going up to Fairbanks tomorrow to meet with TANA Chiefs Conference and others. But the meeting today was not at all a disappointment. Great exchange back and forth. As you know, our Alaska Native healthcare system has challenges, but it's certainly one of the most unique healthcare systems anywhere in the country. A lot of innovative ideas. We did more of what we've typically done with our health, Alaska Native health leaders, is back and forth on ideas, and we're always looking to try to implement those. The Secretary got a number of them. Very quickly, just on the budget reconciliation bill, the one big beautiful bill, we talked a lot about that and the implementation of that. As some of you know, I'm certainly someone who sees this as a really, really important bill for our state across a whole sector of areas: resource development, aviation safety, the Coast Guard, the military, small businesses, taxes, regulations. But what hasn't gotten a lot of attention is on healthcare. As a matter of fact, there's been a lot of ads out, I'm sure you've seen them, that make claims about what this bill does. This bill doesn't cut Social Security, doesn't cut Medicare. For Alaska, doesn't cut Medicaid. As a matter of fact, all 4 streams of Medicaid that come into our state, which is tribal, that's still at 100% federal match. The basic FMAP, as we call it, that's still at 52/48. CHIP program, Denali Kid Care, that's not touched. And the expansion population, none of that is touched. So that's a fact. And we talked a little bit about that, despite what people are seeing on TV. But what we did talk about, and hopefully you have questions for the Secretary and us on, is something that's a real opportunity for Alaska, and that is the $50 billion Rural Transformation Fund that relates to hospitals, relates to healthcare for our state. We, I think, are going to benefit very significantly over the next 5 years in terms of our state for that fund. And I think the Secretary sent out a good message, which is we need to be coordinating with him, the governor, the legislature, with the delegation on that opportunity. And it is a big, big opportunity for our state. So with that, Mr. Secretary, turn it over to you. Welcome again to Alaska, and to our hosts again. Thank you very, very much. This was a really good meeting today.
Thank you very much, Senator Sullivan and Senator Murkowski. It's a joy for me to be here back here in Alaska. I've come here many, many times, more than I can count. I visited most areas of the state, from the Brooks Range down to southeast Alaska. I'm going to get to go fishing in the Kenai. I told Senator Sullivan when he made me make my commitment, which was not a hard sell, to come back to Alaska, that I wanted to do it during the sockeye season.
We want them here at 40 below in the winter, though, too.
But I'm really, really happy to be here. And I was impressed and gratified. These 2 senators, more than any other of the senators, expressed a deep concern and a deep knowledge, encyclopedic knowledge, about the challenges of to tribal health. We just had a really, I think, extraordinary meeting with the Alaska Native Tribal Health Board, with the mega meeting, and we had a wonderful exchange with them. And I'm committed to being the best HHS secretary for the tribes that has ever happened since my agency is created. And we want to work with the tribes. We want to recognize and support their sovereignty. And we want to move the impediments to food sovereignty, to subsistence, to traditional foods. I'm working with the other agencies, with Doug Burgum over at Interior, and with Brooke Rollins at USDA, try to dramatically change the food system so that we can get native foods to all the tribes. The processed foods are literally killing them. They're part of a genocide that is centuries old, and they may be one of the worst parts of that genocide in terms of the impact of processed foods on native health. And I want to add something to, put a little flesh on the subject that Senator Sullivan raised, which is that I know that you've been inundated up here by advertisements saying that there's cuts to Medicaid, Medicare. That is not true. The cuts that are happening are to eliminate waste, fraud, and abuse. That is the work requirements, which are the same requirements that President Clinton put in and that the Democrats have supported for generations. And then to eliminate the fraud, there's 1 million people on Medicaid who are collecting both Medicaid and Obamacare, and that's illegal. There are 1 million people who are collecting Medicaid in 2 different states, and then there are 2 million illegal aliens on Medicaid, and it's illegal for us to make those payments. And we're using AI and we're using innovation to identify waste, fraud, and abuse and eliminate it. And that's the only cuts that we're going to see. The Rural Transformation Program that I want to thank President Trump for putting that in the big, beautiful bill. It is a template for his commitment to improve rural health care, which is a concern here in Alaska, probably more than any other state. More challenges in this state. And traditionally, Medicaid spends about 7% of its budget on rural hospitals. And it's about $20 billion a year. And the big, beautiful bill puts $50 billion over 5 years. It's going to be pretty evenly distributed across the state. So Alaska has an opportunity to really get proportionally more money than any other state. And that will increase Medicaid payments, or the payments to rural hospitals, by 1/3. It's $10 billion a year, instead added to the $20 billion that's already coming through Medicaid. It is going to dramatically increase the flow of dollars into rural areas. And so instead of cutting the flow of federal dollars to rural hospitals, we're actually increasing them by 1/3. And that's something that a lot of Americans don't understand yet, but it's going to happen very, very quickly. The state needs to make its application in September, and the most innovative applications are going to get slightly more money than less innovative ones. However, urge Senator Sullivan and Senator Murkowski to talk to the governor about making sure that he puts in a high quality application. And I'm looking forward to coming back and seeing some of the impacts of that funding increase. I'm just very, very happy to be here. I'm looking forward. We're going out to one of the villages tomorrow. And I'm going to spend the week here, and then we go down to the Kenai on Friday, and I'm really looking forward to this trip. Well, thank you all very much for being here.
Okay, I'm going to open up for questions now. If you ask a question, please state your first name, your last name, your outlet. I'm going to ask questions in the order in which, generally, the order in which they are SVP'd. Please keep it on question on topic. First person is definitely.
Really?
Johnny on the spot. Yeah, you got back to me right away.
Can I get a picture with you afterwards?
Yeah.
I just had a more question more broadly about Alaska. I've lived for 21 years, and we have very, very high healthcare costs. I'm on the exchange. I had my appendix out a couple of years ago. It was $50 grand. I paid 10 out of pocket. Premiums keep going up, and the costs keep going up. And I've heard about this problem ever since I moved here, and it seems like I don't know if it's a federal issue or a state problem, but companies send their people to lower 48 to get procedures, and it's cheaper after the airfare and the hotel. It's a very common problem here. So I guess I'm just wondering about the overall problem with the cost of healthcare in Alaska.
Well, I think everything's more expensive because of the difficulty in transportation, and that when we just talked to the tribal leaders, they have $100 million shortfall in just their medevac expenses because of the difficulty of transportation from the rural areas. And it's something, we're doing everything that we can to address. I don't know what we can address to bring down the healthcare costs. I mean, the biggest thing that, we need to do is to do everything that we can to do preventative care. And this campus is deeply committed to that, to primary care, to preventative care, to make sure that we don't get sick. Healthcare costs are rising across the country at 2% greater than the economy is growing. It's unsustainable. We spend more on healthcare than any other country in the world, 2 to 3 times what Europeans spend per capita, and we have the 6th population in the world. We have the highest rate of chronic disease on earth. Oh, when my uncle was president, the chronic disease rate was about 3%. Today, it's 60%. 85% of our kids can't qualify for military service. And if we're going to address the rising costs of healthcare, we need to start by addressing the food and encouraging Americans to take better care of themselves. We're doing everything we can to drive AI and to drive innovation into our system to eliminate the waste, which will lower costs. But ultimately, we need to also just address the general poor health of Americans. And I'm sorry I can't do better than that, but I think that ultimately those are, what I want to do over the next 4 years, end the chronic disease epidemic.
Can I just add a point to Jeff's statement there? You mentioned that you're on the exchange. The premium tax credits that are made available under the Affordable Care Act expire at the end of the year. One of the initiatives that we are working legislatively on a bipartisan basis is to figure out how we can continue them. Not sure what that might look in terms of a continuation. But the real challenge that we have, the Secretary is right in terms of saying there are no direct cuts to Medicaid through this reconciliation bill. But if people get pushed off of Medicaid because of whether it's not being able to meet work requirements, failing to comply with them, the answer will be, we'll move to the exchange. But if the exchange is no longer affordable, then it doesn't help people who are either coming off of Medicaid or people such as yourself who have been able to afford this high cost of healthcare because of the exchange. So know that there is a legislative effort that is underway to hopefully be able to advance something before the end of the year with regards to the premium tax credits.
Liz Ruskin?
Hi, I'm Liz Ruskin. I'm a reporter with Alaska Public Media. Mr. Secretary, this healthcare system, Alaska Native healthcare system, and the state of Alaska have for years had campaigns to encourage vaccination, to encourage families to get vaccinated. Vaccination was seen as a real hero for the Alaska Native health system. Are you a partner in that? Do you wish that they would follow the full recommendations as the CDC had recommended them? Or do you think that this system and the state of Alaska should be more skeptical of vaccines?
We support vaccination, but what we're doing is to make sure that the vaccines are adequately tested and that we have the best and safest vaccines available to Alaskans and to every American.
And you feel the ones that we have not been tested adequately?
The current vaccine schedule is exempt from safety testing. And so none of the vaccines, with the exception of the COVID vaccine, has been tested against an inert placebo. And that means that we don't know the risk profiles for those products. And people need to know that. And doctors need to know it. they may need to make an assessment about whether a certain vaccine is going to avert more injuries than it's causing. And we cannot say that without doing that kind of testing. So for the first time, we are now going to do, we're going to do real randomized trials on vaccines, which never happened before.
Let's go with local reporters now. Bill Gates.
Hi, I'm Trill Gates. I'm with ABC Fox Alaska. What do you consider the biggest health threat facing Americans, Alaskans today?
I would say the biggest health threat now, if you look at it economically, is diabetes. And if you look at the declines in quality of life, when I was a kid, there was zero. A typical pediatrician would see one case of juvenile diabetes over a 40 or 50-year career. Our most recent data from about 2 months ago shows that 38% of teens are diabetic or pre-diabetic. And it's costing us just that disease, just that kind of mitochondrial dysfunction is costing over $1 trillion a year. And it's not sustainable, and it's terrible for our country. And it's a choice. I mean, in China 20 years ago, there was virtually no diabetes. Today, 51% of the adult population is diabetic or pre-diabetic, and we know why it is. They built 20,000 fast food places, and they began importing American processed food. Processed food, ultra-processed food, gives you diabetes. And unfortunately, particularly with the tribes, with a decline in traditional subsistence food products, there's more and more of a inclination to switch to processed food, and processed food is poison. That, I would say, is the biggest, the number one health crisis that we have in our country.
We'll go to Bill and then Mark and Iris. That order.
Yeah, Secretary Kennedy, you announced just moments before this press conference 500 million canceled in mRNA vaccines. You said in your video that it would increase risk for mutations. Curious how you reached that discovery, as well as if you don't believe we should use mRNA vaccines, what's the alternative, as well as reaction measures? Well,
the mRNA vaccines, we know from COVID, don't work against upper respiratory infections. They don't work very well, let me put it that way. There are two problems with them. One is they target a single protein, which drives what's called antigenic shift. If it drives the virus to mutate, and it actually can prolong the pandemic. And we saw that during COVID. People took shots, mRNA shots for the original COVID variant, and immediately mutated into the Omicron virus, to which the vaccine was ineffective. And that's what it does. And the other issue is that the way that it distributes in the body, the way that it migrates in the body, there's no control over it and no predictability. So it goes to every organ. It turns your body into an antigen factory where you're manufacturing antigens. And different people need different loads of antigens. And in a regular traditional vaccine, the antigen content is very carefully controlled for that reason, because you can injure people. And we've seen now these epidemics of myocarditis and pericarditis, particularly in kids. And for upper respiratory, for some illnesses, mRNA vaccines may be very useful, and and that would include cancers. But for upper respiratory infections, we canceled 22 trials for upper respiratory infections. But right now, we're developing a universal vaccine at NIH, which is a vaccine that addresses the entire phylum of viruses. And so it's a vaccine that mimics natural immunity. And it is effective against any kind of mutation. So it doesn't drive the virus to mutate. And it could be effective. We believe it's going to be effective against not only coronaviruses, but also flu. And it's going to be a much safer and much more effective vaccine.
Mark, did you have a question?
Yeah, no, I have a Mark Cheeson of the Associated Press. Follow up to that, you believe, and I think you said no because of cancer, but that all mRNA vaccines should be eliminated from the market, and then alternately, what alternative technologies should the government be looking at for vaccines?
Well, I just talked about that. We should be, we're right now putting major funding into developing universal vaccines at NIH, and those the program, the mRNA upper respiratory programs that we call at BARDA, we're going to fund that money. We're going to shift that money to develop universal vaccines, which are much better technology, much safer.
We got one more question, and then we'll go to the meeting.
Iris Samuels with the Anchorage Daily News. I have a question for Senator Murkowski. Before you voted to confirm Secretary Kennedy, you said that you sought assurances from him that he would not discourage vaccine uptake. Now been 6 months. I'm curious what thoughts you can share with us about how you think this administration has fared in terms of its messaging on vaccination.
I think I have been very clear in where I come from. I am a strong believer that vaccines save lives, as I believe the Secretary himself has stated. I want to make sure that as an individual or as a parent, I have good, quality, unbiased, scientific backing for the vaccines, but I also recognize that most of us, when we're raising kids or thinking about a vaccine ourselves, we don't take the time to do the research. We want to know that our doctors have access to that. I think this is where the advisory boards that provide for recommendations for the vaccines are important, and that the credibility of those boards is really held intact. And so I have been critical of the fact that the ACIP board was basically terminated and a new group of individuals was installed, because I feel that challenges the credibility of the advisory board itself. So I have been one who has been perhaps more critical of some of the processes, but I don't fault the Secretary for wanting to ensure that there is a more rigorous testing process for our vaccines, although I do believe that we have many vaccines that have been in place for years, if not decades, that have clearly demonstrated that efficacy over a period of time.
Okay, so this is happening live right now there in Anchorage, Alaska. HHS Secretary Robert F. Kennedy Jr. Getting a lot of questions about what we're going to discuss right now, and even Senator Lisa Murkowski, the Republican, facing some questions over her past criticisms of RFK Jr.'s stance on vaccines, on vaccine safety here. That leads us to kind of the same story that RFK was getting a lot of questions on from so many of those reporters in the room. Remember, this event was specifically on rural health care, but the majority of those questions were about this announcement made today by Kennedy saying this: "We've reviewed the science, listened to the experts, and acted. BARDA is terminating 22 mRNA vaccine development investments because the data show these vaccines fail to protect effectively against upper respiratory infections like COVID and flu." He says we're shifting that funding towards safer, broader vaccine platforms that remain effective even as viruses mutate here. So remember, these investments, the headline here, they total $500 million to develop vaccines using mRNA technology. They will now be halted. So this is the announcement RFK Jr. made in a video on his social media platforms explaining the move. Let's listen.
Hi, it's Robert F. Kennedy Jr. here, your HHS Secretary. At HHS, we have a division called the Biomedical Advanced Research and Development Authority, or BARDA. BARDA drives some of our most advanced scientific research It funds developments of vaccines, drugs, diagnostics, and other tools to fight emerging diseases and national health threats. Over the past few weeks, BARDA reviewed 22 mRNA vaccine development investments and began canceling them. Let me explain why. Most of these shots are for flu or COVID, but as the pandemic showed us, mRNA vaccines don't perform well against viruses that infect the upper respiratory tract. Here's the problem. mRNA only codes for a small part of the viral proteins, usually a single antigen. One mutation and the vaccine becomes ineffective. This dynamic drives a phenomenon called antigenic shift, meaning that the vaccine paradoxically encourages new mutations and can actually prolong pandemics as the virus constantly mutates to escape the protective effects of the vaccine. Millions of people, maybe even you or someone you know, caught the Omicron variant despite being vaccinated. That's because a single mutation can make mRNA vaccines ineffective. The same risk applies to flu. After reviewing the science and consulting top experts at NIH and FDA, HHS has determined that mRNA technology poses more risks than benefits for these respiratory viruses. That's why, after extensive review, BARDA has begun the process of terminating these 22 contracts, totaling just under $500 million. To replace the troubled mRNA programs, we're prioritizing the development of safer, broader vaccine strategies, like whole virus vaccines and novel platforms that don't collapse when viruses mutate. Let me be absolutely clear. HHS supports safe, effective vaccines for every American who wants them. That's why we're moving beyond the limitations of mRNA for respiratory viruses and investing in better solutions. Thank you.